Welcome to UNCAGED, the show that celebrates thought leadership from today's top business leaders. The program provides a voice to amazing executives from around the globe who are shaping the world of business today and mapping the path to the commerce of tomorrow. Today, we're speaking with Joey Johnson. Hey, Joey, how are you?
I'm good. How you doing?
I'm very, very well. Joey is the Chief Information Security Officer for Premise Health. Premise Health is a company that is the world's leading direct healthcare provider. Their transformative approach focuses on clinical expertise, easy access to care, and a seamless and simple member experience. We'll talk about what exactly Premise Health is doing, how they've evolved over the last couple of years. But before we get there, Joey, tell us a little bit about yourself and your career.
Sure. So, as you already said, I'm Joey Johnson. So hopefully everyone's figured that part out by now. But yeah, so I'm the CISO for Premise. I've been with the organization here for almost 13 years in that capacity, which is fairly atypical for a CISO. They're typically around 2 to 3 years. So it's been fun to see and build the organization. But, you know, my background is about 25 years in cybersecurity. I held a CISO role before that. Basically, originally a DC guy, but I've been living in Nashville here with Premise Health for the past 7 years. You know, it's actually funny. I didn't really come from a technology background. In fact, there's a funny thing that we're starting to see, especially amongst security leaders my colleagues that I respect a lot. Is really, we'll get into it a little bit about the emotional IQ side of the role that's become so critical. So, you know, I came up in college like a lot of people, working in restaurants, and met my wife then when I was 19, and I was studying anthropology. And after a certain period of time, she said, you know, so what are you going to do with anthropology exactly? And I kind of thought, you know, I don't know. And I had an older friend. He was in his early 30s, and he was working as a salesperson for Microsoft. And I thought, maybe I should give this technology thing a spin and see what happens. I studied it a little bit in school, left from there, went and started working at the airports authority in DC, and took some IT jobs. Started off in networking, and then kind of, you know, really early on got a knack for security. I kind of got the bug. I liked the notion of trying to solve these really complex problems, and that was before sort of cyber is what it is today, right?
Yeah.
Back then, there was very few jobs that even had a security title to it. And I started doing, you know, now they call it ethical hacking or pen testing, but back then they didn't really have a name for it. And so I got into it because I was like, this is a really interesting way to try to solve some problems. My mom was,
you know, it's so funny because now we think about cybersecurity and all of these things as the hottest field. I was on the phone with a dean of a university, and he was telling me all about his new cybersecurity program that they're trying to roll out. So it's all about security, especially as we move into an even more digital world. And you're a bit of a Nostradamus in knowing that this was going to be where things were going to go. But you've been working really at Premise Health now for over 13 years. Tell me a little bit about that evolution.
Yeah, I mean, you know, it's interesting. Like I said, working in DC, I've been doing security for several years by this point. I was the tech guy. I quit working, sold everything I had, went and traveled around Asia for about a year to figure out what I wanted to do with my life. And I decided I wanted to go into management. I worked for some large defense contractors and things like that, and had my first kid. Had an opportunity to take a job downtown in DC, and at the time that would have been like a 2-hour commute each way each day. And I said, I can't pull it off. So I joined this little healthcare company in Reston, Virginia. I'd never done healthcare before and had been used to big shops, but I thought, let me give it a whirl for a year, see what happens. 12 years later, 12 and a half years later, I'm still with the same organization. We've changed over time, the name and multiple M&As and things, but you know, it's been a really great journey. I think, you know, a little bit to understand is kind of what the organization is and does. As you said, you know, we do on-site, near-site virtual health for large employer groups, right? So when a company wants to have healthcare on-site, services on-site or virtually now at post-COVID, right? That's what we do. But it's a really cool kind of business model that I stumbled into, and I was like, hey, this is neat. Why don't more people know about it? The big kind of thing that's so interesting to me is what we call like aligned incentive, where what they really start working on is saying, hey, you know, the typical provider network gets paid, how many people come through your door, how many surgeries or procedures do you perform, all this kind of stuff. It's not necessarily aligned inherently at a macro scale to what's best outcomes for the patient, right?
Right.
Whereas when you have an employer group who's paying their benefits, they want two things. They really want the employees to be healthy and stress-free, and because they're going to perform better, but also, they want to manage their cost. And it's kind of a small portion of the workforce that drives a lot of the healthcare costs, right? The sicker people. And so we kind of looked at that and said, what if you could really change behavior in a way that's aligned to the cost model, but really focuses on getting the person well, right? So we'll have things like a pharmacy, a wellness center, a fitness center, all kind of together in a place, and we can treat people holistically, which helps them get better, right? It drives down costs, but it helps them get better more holistically. Instead of saying, hey, go get some meds, it's, hey, here we'll pair you with a fitness instructor that's going to help you do things and by change little things in your life. So it's been a really cool model. But for me,
I love that.
But for me, obviously running security, it's like, what do you do? We're handling all the sensitive data and healthcare records of all these large employer groups, right? So those organizations care a lot about the security posture of it. You mentioned something funny earlier, which is part of the kind of the journey that's been so cool, is when I came, it was like, what's the relevance of the security program here? And a lot of organizations were still figuring it out. But because our clients are all such large organizations, they are on the front end of kind of risk acceptance and risk management, right? Those are the organizations that started doing things like vendor risk management and going, hey, we got partners who got really sensitive data. Like, what are we going to do with it? And how do we know it's safe? And so really quickly, thanks to my CEO, he realized early on, he said, Joey, this business is going to grow and I'm going to need security to be front and center here because this cybersecurity thing is going to be a big deal. And I said, it's funny, you're the first person I've actually heard that like totally gets it. Like, this is going to be a big deal. And people kind of laughed at me before, but like you said, now we sit here and everybody looks at it and goes, wow, okay, like this is a crazy market.
Yeah, no, I agree. And it's so interesting because data, just managing information in data is in streamlining that process is absolutely critical for any type of healthcare system today, certainly the one that you're outlining and what you guys are delivering, but then also figuring out how to manage the privacy and all of those issues of the individual employees, and then also protecting your corporate or your enterprise customers as well. What a tremendous set of challenges to deal with, and certainly right at the center of how things are evolving. I mean, when you look at this space right now, we've heard about so many cybersecurity issues over the years with big companies. What are the big topics for you guys? What are the kind of the big trends in the space?
You mean from a cybersecurity perspective?
Yeah, just from a security and just general perspective. Exactly.
I'd say I think there's a few of them. The biggest topics on my mind really are one around data, obviously, right? I mean, systems are fine. You can compromise a system of mine, but I can't recover from certain data loss, right? And so everyone hears about ransomware and all of that, but I think really our biggest concern is the evolution of data and the implications of it. So I use this one example all the time that people find interesting, right? Where we are today, historically, we came from like in a healthcare world, you go see a doctor, the doctor treats you, they write up the medical notes, they put it in the medical record application, right? That's 100% HIPAA governed data. There's no question about it. And it's generated by the provider. Now we have a totally different advent. We've got wearable technologies, we've got Fitbits, we've got all these things, which now has the patient actually being the one to generate the data. Really interesting nuance. Here's another thing that makes it interesting. If you take your blood pressure, your cholesterol level, whatever, you take those things, those data elements, and you put them in a medical record application. Again, 100% HIPAA covered data. You take those same data elements, you put them in a Fitbit or a fitness application, same exact pieces of data, totally unregulated. Could be living in cloud data centers all across the globe with who knows who has access to it. And we've seen issues like this, where some of our military folks were using Fitbits and the data got exposed, right? So it's really interesting because the consumer awareness of privacy and security, this data has come to the forefront, right? And we're really going, some of the original constructs that we had to kind of govern this aren't holding up the same way. So that's one challenge.
Yeah.
The biggest challenge that I would say that I think folks don't get when I think about like what is it like a life in the day of a CISO, right? It's
Mhm.
kind of, we all think about the adversary and nation state actors and things like that that are causing problems, but
Right.
that's only kind of one part of the problem. What I think is really, really hard is actually how ubiquitously available technology is to the end user. 10, 15 years ago, people were like, I hope I go to a company and they give me a cell phone and a laptop so I have some compute capability. That'd be cool, right? Today,
Mhm.
everyone's got their own mobile phones. I mean, people can get to any technology they want. They don't need to rely on a company for it. But the data in their brains can leave straight over to their personal devices easy. So you got to be aware.
Mm.
But more importantly, though, aside from the known kind of adversary who's deliberately trying to attack you and they're changing their tactics every single day, you've got the other side of the risk equation is really the rate at which the business is adopting new technologies. Because if you think about it, you've got a finite team of security professionals. So for every new technology that comes in, there's probably some business owner, right? There's hopefully some kind of technology owner who's a subject matter expert. But you've got a very small security team who has to rapidly get to know what that new technology is, get to know it very well, get to know
Mhm.
how it can be vulnerable and how to protect it. And they probably also have to get to know some kind of third-party security tool to actually do the enforcement and protection. That's a lot to ask of a very small team. You're asking
Yeah.
them experts in every single technology domain and data domain. So it's very, very hard to keep up with.
So how
That,
do you, yeah, I mean, that's a great one. I mean, how do you keep on top of that stuff?
well, you've only gotten half the problem, because the other half of the problem is that even if I explain this to my senior management and board and they say, Joey, we hear you, here's $50 million, go hire all the people you need. I can't go get them. They're not out there, right? The
Right.
talent market is so scarce and it's hard to retain people. So you got a
Mm.
real serious business problem here where, the threat landscape is real, it's pervasive, it's constantly changing. Your adversary does not have to adhere to law, regulation, business ethics, anything. I mean, they're inherently criminals and they're inherently actively trying to thwart your program.
Mm.
Got a business that's taking on technology stacks at a faster pace that you can keep up with. And then the only way you could solve it would be to at least bring some people or more technology in, and you can't do that, right? Every
Mm.
product in the program. So even if you try to solve the problem through more technology and automation capabilities, somebody's got to run those tools, right?
Right.
It's a really complex business problem right now. It's even made more complex by the third domain, which is business owners and executives. They tend to understand traditional risk models. They understand financial risk, execution risk, market perception risk, all of the cyber risk, not so much, right? It's really big, it's really complex, and organizations go, we don't even know where to start. We don't know if we're funded, right? It seems like a Mount Everest you got to climb. Like, where do you even start? And so there's a lot of dynamics, a lot of education that has to happen with your leaders and your workforce.
Mhm. I my head is spinning listening to this, Joey, because you're absolutely right. These are huge issues. And certainly when it comes to very sensitive health related information, that's going to be even more important. And I can only imagine that over the last couple of years, we've had to probably rethink the whole approach and strategy with the pandemic. So tell me a little bit, because you guys have physical wellness and healthcare facilities, right? How did you guys manage a model where you went from kind of physical to slightly virtual? I'd be curious to hear how that's gone.
Well, we thought about it a little bit and we said, all right, we're either going to solve that problem or we're going to solve world peace or world hunger. So we chose the first problem to attack. And yeah, it's interesting, right? So if you think about our business model, we're providing healthcare for large employer groups. So as pandemic hit, right? I mean, the demand for frontline providers was crazy, right?
Mhm.
And they're exhausted. I mean, they had to go through a lot,
Mm.
but a lot of our value prop was on-site health centers. So what do you do when thousands of employer groups say, "Hey, we're sending everybody home"? You got to wonder what happens to our wellness centers when nobody's there, or are they even going to be open? What we
I can't
found,
even imagine the calls that you were getting.
well, that's the funny thing, right? Is that what we found? So it was scary. I'm not going to lie, it
Yeah,
was scary. But what we found was that everyone was going through this together. And what most of
yeah.
our clients said is, look, we don't know what's happening tomorrow any more than anybody else does. What we do know is the last thing we want to do in the middle of a global healthcare epidemic is lose our healthcare partner.
Hmm.
And so we did have to pivot really quickly, to virtual delivery. I mean, we already had some virtual services up, but the lines of service that we had to start offering went through the roof. We had
Wow.
to really pivot our business models to providing, screening and testing of COVID services. We were really in the middle of like a lot of crazy supply chain stuff. So we had huge global organizations coming to us saying, can you help us get masks? Can you help us get this? Can you help us get that? And, there was times where we had, storage rooms full of PPE gear and stuff like that we were like, this is like gold bars we're sitting on here, folks. Like we gotta
Yeah.
protect it and make sure we distribute it appropriately and responsibly. But there was all of that. But a lot of it too was conversations with our clients across finance sector, defense sector, healthcare sector, manufacturing, airlines. I mean, all these different sectors that we serve, and they kind of came to us and said, hey, like, what should we do? Like,
Yeah.
what are our competitors doing? Like, what's everybody else in the sector doing? Like, nobody kind of knew. And so we were really at the epicenter of a lot of it, not just kind of from answering their questions, but actually being the entity to provide those frontline services. And then, we had to adjust really quickly with our own workforce. Like everybody, they went remote. How do you secure that? And you saw really weird things like, you used to have behavior models that says, Jimmy only ever logs on at this time, but now Jimmy's logging on at this time. Hey, providers, you're practicing remotely. Please make sure the Echoes and Alexas aren't recording everything in the background of your patient conversations. I mean, a lot of new things to think about. And then even new verticals, like we had to just work closely with our clients and say, let us partner with you. What are we seeing? And we had a big uptick in things like behavioral health, right? People were home, they were locked down, they were depressed, they were having, substance abuse was up, things were going on. And so we had to respond to that call. And we had
Yeah.
to launch all that technology really, really quickly. And I had to make sure we could do that in a secure fashion.
So it was very easy, very seamless. You didn't have to do that much.
So that's why I said we figured we'd move on to world peace and hunger. It was
Yeah, I mean, it's incredible how that space changed. And I mean, I listening to you, the idea that there would be other devices in the home or people logging into from their local kind of servers, et cetera, managing data flows from that perspective. I mean, what a set of challenges. I'd be curious to kind of get a sense of where things are now. How are things evolving? Are people going back to the old models, or have you kind of netted out in kind of a new structure?
I mean, I don't think anybody believes we'll go back to all the way things were. There's some degree of sector alignment in terms of, financial sectors doing things this way and manufacturing's this way and whatever, but each organization's kind of handling it their own way. Our health centers are all up and running again. People are coming in. A lot of people realize I don't want to get up and be in my pajamas all day long and then go back to bed, right? They kind of miss that. I mean, we were hearing stories, people would get up and do a ghost commute to work just to go through it, just to get out of the house and get in that routine and
Oh, really?
that headspace. Yeah, like literally they drive to the office just so they could, people were like, hey, I used to think during that time. I used to process what I'm going to do for my day. And so people would do that kind of stuff. But,
Wow.
I think that the interesting thing is the adoption of virtual health. Obviously, the technology had been there for years, but provider adoption was not there. The doctors didn't want to do it, and patient adoption wasn't there. They didn't want to do it, which is one of those kind of funny value prop cases, because you would think, hey, if you're sick, the last thing you want to do is actually get up and go leave the house and go to the doctor. How about you just pull up your phone and you can do something virtual? The adoption just wasn't there.
Yeah.
Post-COVID world, that adoption is totally there. And I think it's really awesome, honestly, because it's allowed us to really bring care to some of the places it's most needed, to more rural areas and things like that, where, the care is needed there, but people have had a hard time getting access to it. So really accessibility and that member engagement in our world is like one of the biggest things that drives us is how do we get to those most needy communities? How do we serve them? And again, in our business model with aligned incentive, like we call it, our employer partners, they want us to get to those communities. They say, hey, those are our employees. Like we need them to get care. Like how do we solve this together?
Yeah.
It's been great. I mean, that aspect has been great.
That's incredible. And I can see that it will continue to evolve and morph a little bit more as things continue to change quickly. But as you look out in the broader, I'd say, CISO landscape and what you guys are focusing on at Premise Health, what does the near and midterm future look like for you?
I guess I'll answer it in kind of two ways from sort of premise health, what we're doing. With me as a CISO, kind of so baked into the operations, I'll take a little spin and say from a security perspective, what that means. For us as an organization, we are looking really heavily at member engagement, right? Like how do we get more engagement from those communities and help them on an actual journey? We're looking really heavily at something that we call care navigation, which healthcare is complex, right?
Mhm.
You go to a doctor, they say you're going to need to go see a specialist. Almost no one knows who those specialists are. Are they any good? How would I know if they're any good? They seem to cost a lot, and most people don't know things like, well, if you go see that same doctor at this facility on a Tuesday instead of that facility on a Thursday, it could cost you way less, and you're getting the same level of care.
Right.
So one thing we're working on really is called care navigation. We want to get people to the best providers they can, and kind of help them on that journey. It's really, really important. So we're doing that a lot around, like I said, behavioral health and social determinants of health, right? We're really starting to look at sort of the social implications of what drives sort of different areas and communities and demographics, and how we can kind of get in front of that and help those organizations and communities. And again, part of our role is going back to the employer groups and saying, hey, how do your benefits programs look for these kinds of things, right? Like if you want to care for your workforce, if you want to have equality and diversity programs, are you working this into your benefits plan? So we're looking at some of those kind of global macro issues. Obviously, we're looking at the incorporation of medical devices and what the impact on that is on, remote practices of medicine and things like that, which, of course, is going to have security implications, right? Now these are
Yeah.
these individual devices that users are using, and there's some accountability there. I think from a security perspective, a lot of what we're looking at is sort of our digital and data oriented evolution, and how we bring all this data together, and how we make sure that we're doing that in a secure way. One sort of interesting notion that I'll tell you, some people are aware of this, and some aren't. The cost of a stolen credit card on the black market, I mean, it varies, but it could be between 50 cents and a dollar or something. The cost
Yeah.
of a stolen medical record for a while was $50. That's orders of magnitude more valuable. Think about why though. You steal a credit card, the financial institution cancels the credit card. It's done.
Right.
You steal a medical record, someone's social security number, their medical health history, you
Yeah.
can't cancel that out. You can't cancel a person's identity on paper. Furthermore,
Right.
not only that, healthcare is an ecosystem. Do you know where you go for your medical record? Do you know the one place you go? You don't, because it doesn't exist, right? There's every doctor you've ever been to, every walk-in clinic you've ever been to. Your medical record is kind of all over the place, and it gets routed to insurers and pharmacies and all these places. So
Yeah.
when it does get breached, you don't even necessarily know exactly where the source was. A company may
Yeah.
say, hey, we had a problem, but other than that, it's kind of out there. So that stolen data has a lot of tangible value for a long time. So, those are kind of some of the issues that we're struggling with on the healthcare front, and trying to find the best ways to kind of get in front of that, right? We can
Well,
see
step by step on that stuff. I certainly am excited about telehealth and virtual health and kind of virtual health hybrid models. And I think probably as just as a patient, anything that can make managing that data, that medical data, simpler, easier, and safe, it is helpful. I think anybody that goes to any doctor where you have to fill out the same information you filled out 20 million times before, you're like, oh, and then you find out that they send that information out to somebody who transcribes information, so many opportunities for error. It's crazy.
Yeah.
And so anything that can kind of simplify that is really great. And it sounds like you guys are leading the charge on that. Joey, it's been amazing chatting with you. If someone wanted to learn more about what you and Premise Health are doing, what's the best place to reach you?
I mean, you can just look for Joey Johnson, Premise Health on LinkedIn. That's an easy way to find me. I try to be responsive. I get a lot of messages and notices there, but that's a great way. And of course, just hit up our website at premisehealth.com. I don't have a huge Twitter presence or anything like that. I don't have time for it, and the best way to probably find me is LinkedIn.
Excellent. Well, we've been chatting with Joey Johnson today. He is the Chief Information Security Officer of Premise Health. Premise Health is the world's leading direct healthcare provider. Their transformative approach focuses on clinical expertise, easy access to care, and a seamless and simple member experience. We've been talking about really the multitude of challenges that you face on the security front when you're managing healthcare data, and really how Premise Health is leading the charge and building the model for the future. Joey, thank you so much for being on UNCAGED today, and we look forward to having you back.
It's been a pleasure. Anytime.
Cheers.
All right, then.